Good afternoon, everyone. Thank you for taking the time to be here today. My name is Reagan Cunningham, and today I will be presenting my MSN Leadership Practicum project, the How-To Quick Reference Guide for Standards of Care. This project was completed at Coffeyville Regional Medical Center under the guidance of my preceptor, Charlene Paolini, Senior Director of Nursing and Inpatient Services. The purpose of my project was to create a practical, evidence-based resource that nurses could use throughout their shifts to improve efficiency, consistency, communication, and patient safety. The final product is a 137-page quick reference guide that brings together essential nursing information into one organized resource. My practicum was completed at Coffeyville Regional Medical Center, a community-based acute care hospital, critical access hospital that serves Southeast Kansas and the surrounding communities. I completed my practicum primarily on the med-surg unit while working alongside nursing leadership and bedside staff. During my experience, I gained insight into many responsibilities of nursing leadership. While bedside nurses focus on direct patient care, nurse leaders are responsible for quality improvement, policy development, staff education, patient safety initiatives, regulatory compliance, budgeting, staffing, and supporting nurses throughout the organization. Being able to observe these responsibilities firsthand gave me a much greater appreciation for everything leadership does behind the scenes to ensure patients receive safe, high-quality care. Needs assessment. The idea for this project developed early in my practicum through direct observation and conversations with both nursing leadership and bedside nurses. Although CRMC has policies and procedures available electronically, nurses frequently had to search through multiple documents and resources to locate information while caring for patients. During a busy shift, this can be time-consuming and frustrating. The challenges especially were noticeable among new graduate nurses, float nurses, travel nurses, and nurses performing unfamiliar procedures. Leadership recognized an opportunity to create a one organized bedside resource that could improve efficiency while promoting standardized nursing practice. After identifying this need, I developed the idea for a comprehensive quick reference guide that would place commonly used information into one location. Creating this guide was also a personal investment. I personally funded the first copy at a cost of approximately $41, which included purchasing the 1.5-inch binder, laminating supplies for all 137 pages, a printing entire guide from the Coffeyville Public Library. I wanted the resource to be durable enough for everyday use on a nursing unit. Project overview. The result of this practicum for the How-To Quick Reference Guide for the 137-page evidence-based bedside reference manual. Although the guide contains 137 pages, it was initially designed as a quick reference manual rather than a textbook. Information is organized into concise sections that allow nurses to quickly locate information during patient care. The guide contains 29 sections, including admission process, discharge and transfer, rapid response and code blue, incident reporting, infection prevention, sepsis, pain reassessment, fall prevention, Foley care management, and CODIs, continuous bladder irrigation, internal feedings, IV therapy, pumps, blood administration, telemetry, wound care, respiratory support, restraints, provider communication, and unit resources, and supply locations, and many additional topics that nurses encounter every single day. Rather than replacing hospital policies, this guide complements existing CRMC resources by providing nurses with immediate access to evidence-based information right at the bedside. It was created for new grads, experienced nurses, float nurses, travel nurses, nursing students, and anyone who just needs a refresher. Project goals. The primary goals of this project were to develop a evidence-based bedside resource for nurses, standardize common nursing procedures and documentation expectations, improve efficiency by reducing time spent searching for policies, increased confidence among new grads, float, and travel nurses, support evidence-based practice, improve communication and patient safety, and create a resource that could continue benefiting the organization long after my practicum ends. The outcomes. Seeing this project move from an idea to an implementation has been one of my most rewarding parts of this practicum. On July 21st, 2026, I placed a rough draft of my quick reference guide on the MedSearch unit so nurses could start reviewing it and in real clinical practice. This allowed staff to evaluate the layout, identify any missing information, and provide suggestions before the guide is finalized. I am scheduled to return on August 3rd to collect additional feedback and make any final revisions based on staff recommendations. The completed guide will be finalized and officially placed on the nursing unit on August 5th, 2026. Although formal outcome data have not been collected, I anticipate this guide will improve nursing efficiency, increase confidence among staff, promote evidence-based practice, improve documentation consistency, and ultimately contribute to safer patient care. Stakeholder feedback. One of my favorite aspects of this project was involving bedside nurses from the very beginning. Before writing this guide, I met with MedSearch nurses, ICU nurses, emergency department nurses, and I asked them what they wished for that could be available to them for their shifts. Rather than assuming what nurses needed, I wanted the guide to be developed using feedback from people who use it every single day. Many nurses suggested including information on sepsis, blood administration, Foley cath, telemetry, IV therapy, restraints, provider communication, and documentation requirements. Receiving this feedback before beginning the project ensured the guide reflected real clinical practice and addressed actual workflow challenges. Throughout this development, nursing leadership also reviewed the guide and provided valuable recommendations that strengthened this final project. Sustainability. One of the greatest strengths of this project is to design to be evolving over time. Healthcare is consistently changing, technology changes, evidence changes, policies change. Nursing itself is continuously changing. Because of this, the how-to guide cannot remain the same forever. Just like nurses adapt throughout their careers, this guide must also adapt. The electronic version can be updated whenever CRMC policies change and new evidence becomes available or additional resources are needed. Future nurse educators and leadership can easily revise existing sections, add new topics, and continue improving the guide so it remains a valuable resource for years to come. Professional growth. When beginning my practicum, I wanted to strengthen my leadership skills while gaining a better understanding of nursing administration. This project allowed me to improve my communication, collaboration, project management, organization, and evidence-based practice skills. Throughout the project, I demonstrated several AONL's nurse executive competencies: communication and relationship building, knowledge of the healthcare environment, leadership, professionalism, business skills, and principles. Lessons learned. This practicum taught me so much more than I expected. More importantly, it taught me a lot about myself. Before starting this practicum, I honestly believed leadership mostly involves sitting behind a computer, handling paperwork. I think many bedside nurses have probably thought this same thing at one point in time. This experience completely changed my perspective. I now understand that nursing leadership is constantly evolving, working behind the scenes to solve problems, manage resources, and oversee quality improvement projects and ensure nurses have what they need to provide excellent patient care. Although my long-term goal is still to become a family nurse practitioner, this practicum gave me an entirely new appreciation for nursing leadership and administration. It showed me that the amount of work planning, communication, and collaboration required to be successful in a led organization. Whether I become a nurse practitioner, a nurse leader, or both, this experience has made me a stronger nurse and will influence how I support my coworkers throughout the rest of my career. These are my references that I used for my project, specifically for my final project. This was a message I wrote to our nurses and staff. Publication information, first published an edition. This guide is a living document and will be reviewed and updated as an evidence-based practice, healthcare guidelines, hospital policies, and clinical standards evolve. Acknowledgements. Thank you all for your time and attention today. I appreciate the opportunity to present my project, and I hope you have an amazing day.